Chronic myeloid leukemia, or CML, is a rare form of cancer that typically affects older adults, though it can occur at any age and is slightly more common in males than females. CML is a type of blood cancer that starts in the bone marrow, the soft inner part of the bone where stem and blood cells are formed. With CML, abnormal white blood cells called blasts multiply quickly, upsetting the growth and normal function of healthy cells. While there is no cure for CML, recent treatment advances mean that most people diagnosed with CML today can expect to have a good quality of life and a normal lifespan. Hearing someone you love has CML can be overwhelming. It's common to experience feelings of fear, anxiety, denial, anger, and depression. If you're helping your family member or friend through cancer treatment by regularly going to the doctor, making meals, providing emotional or spiritual support, you are a caregiver. As a caregiver, you play a key role in supporting the physical and emotional well-being of the person you care for. Communication is key when it comes to caregiving. You and your loved one will need to be open and honest with each other from the start. You may disagree and even fight, but always keep the lines of communication open. It's important to listen actively, make eye contact, and give your full attention. Sometimes simple expressions like, "I'm here for you," or "let me know how I can help," are the most meaningful. Other times, just being there and listening is the best thing you can do. It is best to avoid saying things like, "I know exactly how you feel," and making comparisons to other people who had cancer. Every situation is different, and you cannot know what they're dealing with. A person with CML may need different types of care depending on their age, diagnosis, treatment plan, and overall health. Your loved one may only need help from time to time, or they may need constant care. It is different for everyone, and that may change over time. Setting boundaries and expectations early on can make things easier. Don't try to guess about what your loved one needs or wants. Find out what works best for you both. A simple list of questions can help get the conversation started and clear up any confusion. Caregiving responsibilities may include driving your loved one to appointments, taking notes during appointments, going grocery shopping and cooking meals, assisting with personal hygiene and changing clothes, household chores, managing finances, managing medication, managing side effects, and communicating with family members and the healthcare team. As a caregiver, you may become your loved one's gatekeeper when friends and family members reach out to express concern or ask for updates. Ask your loved one who they want to tell and how much they want to share. Be careful about what information you post on social media. Your loved one may become forgetful, have trouble concentrating, or seem confused at times. Be patient and understanding. If your loved one is struggling to remember things, suggest writing a to-do list or setting alarms on a mobile phone. Ask if it's okay for you to remind them to take medication or carry out other tasks before doing so. Communicating with the healthcare team is key. If you have permission, keep the team aware of missed medication doses, symptoms or side effects your loved one is experiencing, including how long and how often they are happening. It can be helpful to keep a notebook to record this information between appointments. If you're preparing meals, do not be surprised or upset if your loved one's food preferences change from day to day, or they don't enjoy a favorite food. CML treatment can affect appetite and make it difficult to eat. Offer gentle support rather than pushing your loved one to eat. Keep food within easy reach so your loved one can have a snack whenever they're ready. Try having applesauce or diced fruit on the bedside table, roasted nuts on the counter, and cut up fruits, vegetables, and dips in the fridge. Speak to your doctor if your loved one has not eaten for 2 days, or call the LLSC to access the services of a nutritionist free of charge. Your loved one may worry about being a burden or losing independence. If they are capable of doing certain activities, encourage them. But be prepared to do what you promised to do. Your loved one needs to be able to rely on you. Caring for your loved one can be rewarding, but it can also be challenging. It can affect you physically and emotionally. You may have difficulty sleeping and feel fatigued, irritated, or sad. You may also find social and family life are impacted. Remember to take care of yourself, get proper sleep and nutrition. Stay active and do things you enjoy. Ask for and accept help when you need it. Set boundaries and focus on what you can do instead of what you can't. Speak to the Leukemia and Lymphoma Society of Canada about the community resources that are available to support caregivers with services like adult daycare, financial, or transportation assistance and counseling. If you're feeling overwhelmed, getting sick a lot, gaining or losing weight, or turning to alcohol or substances, talk to your doctor about the stress you're experiencing. At some point, you may feel resentment toward your caregiving responsibilities, or even your loved one. These thoughts may be followed by feelings of guilt. These are normal and common feelings. Caregiving is a difficult job. Your physical, emotional, and mental health is vital to the well-being of the person you're caring for. To be a good caregiver, you must be good to yourself. Remember to stay connected. You'll have a better quality of life and be better able to help your loved one manage their CML by reaching out, communicating with the healthcare team, and surrounding yourself with a support network. You're not alone. The Leukemia and Lymphoma Society of Canada is here to help CML caregivers understand and manage the road that lies ahead.